For maxillary dental arches with a normal form, such as we have here, a prefabricated splint can actually fit quite well. With a smaller arch, the palatal extensions contact the premolars, so the splint does not fit properly over the anterior teeth. No problem. Shortening or removing these extensions would permit immediate relining. For the clinical case, we have intentionally selected a more difficult patient. With this narrow arch and somewhat prominent central incisors, the unmodified FOS cannot be placed over the teeth because the palatal extensions are in contact with the premolars. The extensions can be easily removed with a wire cutter. Without the extensions, the splint does fit over the teeth, but is being pushed to the labial by the prominent central incisors. Therefore, about 1 millimeter of material will be removed from the inner surface. As you can see, the FOS now fits significantly better, and the position is stable. Achieving a stable position is a big advantage when relining. One final change before the splint will be relined clinically. There is more than enough retention with just the central incisors. The labial flange will therefore be reduced to eliminate the undercuts on the laterals. Marking it with a felt tip pen is a good orientation. The undercuts on the laterals are now eliminated. We're ready for clinical relining. We are using a bonding technique called thermal welding. A standard dental torch is passed briefly over the inner surface, and the monomer is applied immediately. This surface is now a chemically active methacrylate and will bond to the relining resin. Cool the splint before mixing your relining material. The FOS is filled with the relining resin and seated at first with pressure to achieve the predetermined position. Following this, it should only be held passively. The relining resin must reach the elastic phase before removal. Here, it is still plastic. Check it every 10 to 15 seconds. Now the resin is elastic, and the splint will be removed from the mouth. We can see how the relining resin has flown into the embrasures. These will be removed with scissors or a burr. Excess resin is removed, and sharp edges naturally are rounded. After the retention has been adjusted, the antagonist contacts are marked with 2 different colors of occlusal foil. I prefer red for all eccentric mandibular movements. Following that, I mark centric contacts in blue. Here we can see centric contacts on the left central and the right lateral. First, the stronger contacts with excursive movements are reduced. The goal is to achieve an axial load of the mandibular incisors. The splint is placed back into the mouth and the contacts marked again with the same method. A mirror is being used to check the location of the contacts as well as the contact angles. Now we have 3 mandibular incisors in centric contact, and excursive contacts are okay. Rough areas on the splint itself can be polished most quickly by melting the surface with a torch. The edges near the relining material are polished conventionally. Examine the clearance of all posterior teeth and the canines in all mandibular positions. Every splint is different and individual. More information is available on our website.